So good afternoon, everyone, and thank you, Paddy, for a really lovely introduction. It means a lot to us to know that Paolo continues to be remembered for his work, which was such a big part of his life. We'd like to start by saying a heartfelt thank you to Paddy and everyone at the City Health International for inviting us to the conference here to present the Paolo Pertica Award. Before we talk about our outstanding award winner of 2021, we'd like to say a few words about Paolo. It's quite a poignant event for us, so just excuse our nerves, please. Like all of us, Paolo's experiences in life shaped him, some in a positive way, and others not so much.
But today we're here to share about how my dad used his experiences in life to benefit others. He was the person you would want in your corner if you were having a tough time. He was also a relentless supporter of people in crisis, and particularly people who had problems with drug and alcohol addiction in the criminal justice system. He fought to achieve health equity for some of the most stigmatised people in our societies.
Dad enjoyed telling stories to anyone that would listen, and there were a lot of them. But the one that sticks in my mind is when he was working as a prison drug worker in London. He was visiting HMP Wandsworth when the alarm went off, and particularly surprised. And at the time, he had long hair in a ponytail and a pretty casual look, so he wasn't particularly surprised, although a bit shocked, when in the heat of the moment, a prison warden mistook him for an inmate and pushed him into a cell with another prisoner. As the prison was in lockdown, there wasn't much he could do, so after introducing himself to his new cellmate, he noticed a chess set and was soon engrossed in a game. When the cells were finally unlocked and a very apologetic prison officer offered to escort him quickly out of the prison, he said thanks, but could he finish the game first?
I know that Paolo would be absolutely thrilled to know that the Paolo Pertica Award 2021 is going to Marjana Excel, as are we. A doctor and a surgeon, after graduation from medical studies in Krakow, she worked first in the Department of Surgery at the University Hospital of Krakow, and then in the Department of Thoracic Surgery at Zakopane. She spent the next 3 years as a doctor in a mission hospital in Zimbabwe. And after returning to Poland, she took up a job in the prison health service, first in the prison hospital in Krakow, and then for almost 10 years, she held the position of chief prison doctor. During this period, she and the health service office team cooperated extensively with many national and international partners, including the National Bureau for Drug Prevention, the National AIDS Centre, the World Health Organization Health and Prison Project, the Central and Eastern European Network of Drug Services in Prisons, and later with the European Network for Drug and Infections Prevention in Prisons. It was thanks to her efforts that prisoners began to receive antiretroviral drugs on the same basis as any other patients, financed from the Ministry of Health budget. It was also in this period that the first methadone programs were established in Polish prisons. Not without significance was the wide-ranging training activity in public health issues carried out in this period, addressed not only to medical staff employed in prisons, but also including both prison guards and directors. The Prison Health Service logo used at the time, a heart behind a grille, was intended to symbolize the ethical standards binding staff towards the patient, the prisoner. After leaving the prison service, she was a member of the Council of Europe's European Committee for the Prevention of Torture for 12 years, continuing to work on issues relating to the healthcare offered to people deprived of their liberty. Currently, as an expert of the Council of Europe, she continues to participate in various projects related to this topic. Congratulations, Marzena. It's an absolute privilege to present this award to you. Your work over your whole career is a complete inspiration to everyone. Your dedication and significant collective achievements have resulted in many of our most stigmatized communities having a healthier and happier life. Congratulations.
Dear Pauline, Matteo, Daria, dear Paddy, Szanowni Państwo, serdecznie dziękuję.
Cordially thank you for granting me this exquisite award, and I won't be hiding that when I learned that I am a winner, I started to think about it very much because, well, we had this lockdown period and we had the time to stop and we have to summarize certain things. This has been 30 years of my career in healthcare that is provided for people deprived of their liberty. What was said about my achievements, well, I think it wouldn't happen if it were not for my curiosity for the war and my decision to take my job in Africa, in Zimbabwe, and I had to requalify from the general surgeon to a multi-specialist in charge of people suffering from HIV or pneumonia or obstetrician, working as an obstetrician, as a pediatrician, as a public health specialist in a mission hospital including 30 beds. So if on my career coming back from Africa, if I didn't meet many wise people such as the heads of the prison service, General Purser, Permiankiewicz, Popiołek, or Mr. Szostak, who supported me in my new projects. As a head of the prison health service, I cooperated with many representatives of the Ministry of Health, but unfortunately, just few of them understood that what's important for the public health is the population of prisoners. I think that Mr. Andrzej Ryś was such a minister that the current director at DG Sanko for the European Commission. So these people included Mrs. Anna Maciec-Bogusławska, the head of the National AIDS Center, HIV Center, Mr. Piotr Jabłoński, Mr. Bogusława Bogusław, and the heads of the National Office for Drug Abuse. I remember quite well that we had this long-term negotiations with the former advisor for the Minister of Health. We provided the prisoners to antiretrovirus treatments for HIV. I remember that with Mr. Mark we started our training, harm reduction training, and I remember starting of the first or launching of the first national program for methadone in Poland. Well, this event would not occur, today's occurrence, if there were not for my cooperation with Paddy and the Crown Store team. Well, it was, I believe, 2002 or 2003. I remember that when I met Paolo and when he arrived at the conference to Popovo. And I remember that many people who are attending this conference too are so important, because I remember that in 2007 to the conference, and all these achievements were achieved also thanks to the collective work of the whole team, of the Wojtek Rudalski, Halinka Strzelecka, Marek Bujak, the whole office of the health service. So let me also thank for the support and understanding of my husband, who is a psychiatrist. And I think his high moral standards always make him treat a prisoner on an equal basis with his regular partners. And I would like, of course, thank to my late mother that she brought me up and she taught me respect to another human being. And I believe that all of my achievements were also related to the belief of the 11th commandment. Well, that was defined by Marian Turski, which means do not be indifferent. And I would like to dedicate my award to all representatives of health service who are not indifferent, who provide help to the detainees at police officers, for whom the prisoner is a patient, most of all, who with huge dedication and help to COVID patients, also exposing their health, and to all of them who in this dark room are present in the forest on our national border with Belarus. And thanks to them, many refugees managed to save their life and health. So at the end, let me just address my son, Jacek. As a small boy who used to participate in all these conferences, and his generation, my son's generation, son, do not be indifferent. This is the address to all his generation.